So I shall start from the beginning again. It'll be easier because I didn't get very far. So I'd like to thank the organizers and for allowing me to make this presentation and on recombinant protein immunoblots for the diagnosis and differentiation of babesia microti and babesia duncani infections. So IDFISH and IGeneX are engaged in the diagnosis and research into tick-borne diseases. And this is part of the work. So babesia is a protozoan parasite that gets infected by feeding on mice carrying the parasite, wild mice, white-footed mice, and also deer in the US, for example, that carry babesia parasites in their blood. So gametes formed by the gametes of the parasite are picked up by the tick during a blood meal. And the gametes, if there are male and female gametes, they fertilize in the gut to produce ookinates, which enter the salivary glands of the tick, where multiplication results in the formation of numerous sporozoites, which can then be transmitted to an uninfected mouse to continue this cycle in the blood of trophozoites, giving rise to merozoites, and that includes merozoites which infect uninfected red cells. But also the sporozoites can be inoculated on the rare occasions when ticks feed on humans. So these are fairly rare occasions. And there, the sporozoites develop into trophozoites within the red cells, the infected red cells. The trophozoites divide to form merozoites, which are released from the red cells by lysis, and then the merozoites can infect fresh, uninfected red cells to continue the cycle within the blood before the infection is resolved. Now, the concern here is that humans carrying infected red cells can also unknowingly donate blood carrying the infected babesia parasite, which can then, when transfused into a recipient, cause babesiosis. So donor blood has to be always checked, and is checked in the US for babesiosis. So that's a diagnostic issue. Now, babesiosis has a worldwide distribution. It's found in all the major continents, and there are an estimated 6 cases that occur per 100,000 people every year in the US. There are 2 major parasites species, babesia microti in the northeast and midwestern states, babesia duncani in the western states of California and Washington. Babesia divergens is very common in Europe, and divergence-like species are also found in the US. The symptoms are fairly non-specific. They include fever, chills, sweating, myalgias, fatigue, very common in other tick-borne diseases as well. Hepatosplenomegaly and hemolytic anemia also occur in babesiosis 1 to 4 weeks after infection, and they can last several weeks until resolution. Hepatic, renal, and respiratory complications are possible, and the disease is severe in people who are immunosuppressed, who've been splenectomized for various reasons, or in elderly patients. Chronic infections can also result from babesiosis that involves tissue sequestration of the parasite. And this is in deep tissue, so that the parasites tend to disappear from the peripheral blood, and they also result in antibiotic resistance to treatment. Infection is normally by hard ticks, the Ixodes species ticks for babesia microti, Dermacenta for babesia duncani in the US. Now, the lack of pathognomonic signs and symptoms makes the laboratory diagnosis of babesiosis essential. And this has typically been done in the past by examining thin and thick blood smears after staining with Giemsa. And this is useful at high parasitemia. For example, 200 parasites per microliter should be picked up by most microscopists. But at low parasitemias, this is not very effective. And that detection at low parasitemia is often necessary for testing blood for transfusion. In malaria endemic countries, because of their very close genetic relationship and structural relationship, babesia parasites are often mistaken for plasmodiums parasites in blood smears, leading to misdiagnosis. Now, other direct tests for babesiosis include the use of PCR, which can detect 1 to 10 parasites per microliter at the lower limit, and fluorescence in situ hybridization tests, which can detect about 58 to 60 parasites, as we estimated, per microliter as a low limit of detection. Indirect tests for detecting babesiosis involve the use of immunofluorescence antibody tests, or IFAs, and these are tests that involve reacting serum from suspected patients with the parasitized red cells produced in hamsters. Now, high IgG titers, antibody titers, in the IFA test is usually diagnostically supportive, and IgM titers greater than 32, for example, is common in early infection before IgM switches to IgG, which, or incidentally, doesn't always happen quickly. To detect active infection rather than resolved infection, because antibodies do persist after disease is resolved, is one needs to test the antibody titers at different time intervals so that an increase in titer is indicative of active infection. And we've also shown that detection of both IgM and antibodies is important because IgM is important, maybe the only antibody present very early on in the infection. This is a slide showing fish tests being done on different babesia parasites. Here we used a genus-specific fluorescent probe that is directed to hybridize to ribosomal RNA. So this is not species-specific. And here we have Giemsa-stained blood smears of babesia microti, and this is babesia microti fish tests done on erythrocytes obtained from hamsters, parasitized babesia erythrocyte, parasitized red cells from hamsters carrying babesia microti. And these are two pictures of human patient red cells reacting with the babesia fish probe, the babesia genus-specific fish probe. Series B is the same, done with babesia duncani from hamsters and from patients. Series C is Giemsa-stained blood smear here, and babesia divergens from cultures. And D and E represent reactions observed with babesia bovis and babesia bigemina, which are bovine babesia parasites that infect cattle. So essentially, the fish test that used here is genus-specific. It reacts with all babesia species. It occasionally picks up Sileria equi, which is a animal babesia parasite, but otherwise it's extremely specific. It doesn't cross-react with malaria parasites or other epicomplex parasites. For diagnostic purposes, it's often important to do parallel direct and indirect tests. For example, you can have patient samples that are FISH positive and IFA negative, FISH positive and IFA positive, all of which indicate active infection. And this is in 249 patients, suspected patients with babesiosis, and FISH negative and IFA positive, and FISH negative and IFA positive with a low titer, where we would interpret these as being probable resolved infection in low titer and probable active infection in high titer situation, even though they are FISH negative, because the parasites are present at very low concentrations or have disappeared from peripheral blood into deep tissues. So that is necessary. Now, speciation into Babesia microti or duncani or divergence is important for epidemiological purposes and sometimes clinical use as well. And this is best done by DNA sequencing and PCR or PCR tests, but it's very difficult or impossible at very low parasitemias in the peripheral blood, or in other words, when the parasites have disappeared from peripheral blood and sequestered in tissues. High specific antibody titers can often differentiate between Babesia duncani and Babesia microti. In other words, you have specific reaction with Babesia duncani grown in hamster red cells or with Babesia microti grown in hamster red cells. There is a possibility of cross-reaction, but this is, in experienced hands, this is not too much of a problem, but it is a minor problem. But if you want to extend this, the IFA test to the other species of Babesia, the supply of parasites in hamsters becomes a problem, and these are not readily available. We have, in IDFISH, developed a FISH test that we think can differentiate Babesia duncani and microti at this sort of limit of detection. But this work needs a bit more work before it can be published and shared publicly. So we considered, IDFISH considered the use of immunoblots for detecting babesiosis. Immunoblots are a form of Western blotting where recombinant purified proteins are used as a convenient alternative to whole cell lysates. And IDFISH and IGeneX have used immunoblots to differentiate between Lyme disease and relapsing fever, which are caused by different groups of closely related Borrelia species, two different groups. And that's been quite successful, and details are available in these publications. So for babesiosis, IDFISH decided on selecting 13 recombinant proteins from microti and 6 from duncani, applied them as lines on nitrocellulose membranes as target antigens, and then reacted them in the typical immunoblot procedure with serum from patients suspected with babesiosis. And so recently, 72 sera from babesiosis patients were tested in immunoblots together with 24 control sera. And these are babesiosis patients that were either FISH positive or IFA positive. And 87.5% of the sera reacted in the Babesia immunoblots, with many tentatively identified as being caused by microti and others by Babesia duncani infections, respectively. The control sera from other tick-borne diseases were negative in the immunoblots. Quite a lot of IgM showing early infection, and about half the samples were positive for IgG antibodies. So let's look at some of the immunoblots. So these are the 13 microti and 6 duncani antigens. Duncani antigens here, 14 to 19, and microti from 1 to 13. These are different proteins from the two species. C1 and C2 are control bands that are always run in immunoblots to show that the test is working. And here the antigens have been reacted with a mixture of polyclonal antibodies that would pick up all of these antigens. And this the negative strep is reacted with control serum. In real life, these are 3 patient samples. Microti is identified by the presence of bands 12 and 13. So this serum reacts with band 12 antigen in both for IgM antibodies and for IgM antibodies and for IgG antibodies, plus several other proteins. Serum 3 is identified as resulting from a duncani infection because it reacts with band 15, which is specific for duncani. And the other bands are often present in the immunoblots, but if there is none of the specific bands, 12, 13, or 15 are present, they are identified as being babesia genus specific, often where we couldn't identify the species as duncani or microti. So this is very much work in progress still, and one is looking at different recombinant antigens to try and narrow down and get multiple bands that are specific for microti and duncani. And they actually show the potential for using immunoblots rather than IFA tests on hamster-derived babesia parasites, because it's so much easier and more standardized, and also immunoblots the reading of immunoblots can be done automatically in a machine. So that's the advantage of immunoblots. So hopefully the use of immunoblots will be reported in the very near future with a larger number of samples for publication. So I'd like to thank you for your attention on this